Is socialized medicine better than health for profit? I'm Tapiwa. I am a nurse who has worked both in the UK and in the USA, and I feel that I'm qualified to comment on the differences between the two. And I'll give you my opinion as I describe the differences between the two, just because I've experienced both systems and I can speak to both of them. So, socialized medicine, that's free healthcare, like in the UK or Canada, and I think Germany as well. I can only speak of the UK because that is where I have lived. I lived in the UK for 18 years. I did my nurse training there and worked there for 18 years. And then I moved to the States and I've worked here for 6 years as a nurse. And so I can speak to both systems. The first thing I'll talk about is from the perspective of the nurse or healthcare professional. If you're working in the UK, you're most likely going to be working in older facilities. The hospitals will probably be older, more old fashioned. The equipment is also going to be older than what you would find in the US. In the US, the facilities are more modern, the equipment is more up to date and expensive. And I would even go as far as to say that there is more equipment. Things here are far more advanced than what they are in the UK. I'll give you an example of medicines. In the UK, when I was there, I don't know about now, I would have to ask people who are still there. If you were doing medicine administration as a nurse, you would walk around the unit with a big wooden trolley, which we would call the drug trolley. And in there, you would have boxes of medications, and we would organize them in alphabetical order to make it easier and faster to find medications. And so you'd go around from patient to patient. You would have to use a paper drug chart to see the patient's name, allergies, date of birth, the patient identifiers, things like that. And then you're looking from medication to medication. Like this medication is prescribed at 8 a.m., 2 p.m., 8 p.m. So if you're doing the morning round, you're checking to see what you're giving at 8 a.m. So, just that's how backward that was. You come to the US, everything is kind of automated. So you have an automatic medicine dispensing machine, like the Pyxis or the Omnicell. So you go into the med room, which is the medicine room. In there is a machine that has little boxes and cubicles with medications in them. And you touch with your fingerprint and it identifies you. So from the moment that you access that machine, it knows when you accessed it, what medications you took out, and what time you took them out. So, and also who you took them out for. So that way they can be charged to the patient. So you see the difference already. With the big drug trolley, there's no way of really tracking which medication was given to which patient, or even the speed with which medications are being used. I mean, they could probably go through the charts and see how often medicines are being given on this unit, and therefore we can expect to restock the amoxicillin at that time. But with an automated system, all those things are happening in an automatic way. So periodically throughout the day, the pharmacy technician will come onto the unit in the US and they will refill any empty cubicles in the Pyxis or in the Omnicell and make sure that whatever medications you need are already there. You're not calling pharmacy and saying, hey, can you please send us this or that? It's all automated. Yes, occasionally there'll be occasions when you have to call the pharmacy if you get an order that comes up suddenly during the day and it's not a medicine that is stocked on the unit. they will also see the order because they have to verify it, and they'll send it up to you. But sometimes it doesn't come as quickly as you would expect. And so you might send a message through the patient's medical administration record. You would just message the pharmacist, and then they will tell you, I've sent it down in the tube system. So that's another thing. We didn't even have a tube system in the UK. So you can see that the vast differences between the US and the UK in terms of technology and advancement, and the type of facilities that you're working in. And then we talk about systems and structures. The UK is very, I'd say, people driven, as opposed to the US, which is like a corporate structure. So in the US, there's a lot of talk about metrics, numbers. Are we achieving this metric or that metric? Productivity is a daily topic. If you work in a role that allows you to attend daily huddle is in a boardroom. In the boardroom, you've got the CFO is in there, nurse leaders are in there, people from security, risk management, anyone who is in leadership in the hospital goes for a daily huddle in the morning, and they talk about what's going on in the hospital. And productivity is a daily topic. So this is something that drives how things are done in the hospital. It's a very important part of how things work in a US hospital. In the UK, yes, there is talk of KPIs and all that, but I find that the system is more about people, because it's socialized medicine. So the focus is very much on the people as opposed to money. And then you look at how our hospitals are funded in the two different systems. From what I remember, in the UK, I think 6% of your pay would go towards NHS, the NHS, so NHS contributions. So I think 10% of your pay was NI contributions, and I think part of that would be the NHS, which I think 6% was that. If I may be mistaken, but I think that's how that was. In the US, on the other hand, you pay for your healthcare. So if you're a person who is employed, on your check at the end of every pay period, if you've chosen or elected healthcare benefits, you will contribute, I would say, about, depending on which plan you choose, you can choose, a really cheap plan or a really expensive one. But you have to make that decision based on your health needs. If you think, well, I'm actually fairly healthy and I don't need to pay for a very comprehensive healthcare plan, you can pay for something that costs you maybe about 200 and something as an individual, and your employer pays the other half. So maybe in total for you as an individual, it's about 450. So half of that is paid by the employer. If I think about what I used to contribute in the UK from my check, I'd say it was about the same amount of money. So I don't think that UK healthcare was free in the true sense, because I still had to pay for it from my check. The only difference is, while I'm here in the US, if I'm sick, I'm not being put on a waiting list to see a specialist. If I'm sick and I've got health insurance, I can see a specialist pretty much immediately. In the UK, on the other hand, you're going to be on a waiting list. And I remember back when I was still there used to be talk of postcode lotteries, where if you live in certain areas, it's going to be harder for you to get an appointment to see a doctor, whether that's a family doctor or to be referred by your family doctor to go and see a specialist of whatever kind. I'll give you a personal example. I lived in a really nice area in Kent, but that one area had one doctor's surgery. And so it was oversubscribed, not just by our local community. We were in a community that was kind of enclosed, which had its own facilities like supermarkets, golf course, a health center, schools, and all that, and there was one doctor's surgery. But this area was growing, and on top of that, the doctor's surgery was also serving the smaller villages that were nearby. And so it was really difficult to get a doctor's appointment. Sometimes you would have to wait as long as 2 weeks before you could see your doctor. And by then, you've either resolved your problem or maybe you've gotten worse and have had to go to the hospital. And so, even though we lived in a really, what I thought was a really nice, a good area, it was still difficult to see a doctor. In the US, um, you can see a doctor pretty much immediately if you wanted to. So you can see your family doctor if you think your problem can wait a few days, or you can ask and see if they have a walk-in appointment, or you can also just go to an urgent care center if you think that your problem needs attention urgently, but not necessarily going to the emergency department. So again, that depends on the kind of coverage you have, whether health insurance, or if you're a cash paying person, whether you're able to afford it. So yes, there's the disadvantage of if you didn't have health insurance coverage or money to pay for healthcare, then it might be really difficult to get seen in the US. But then if you're in the UK, yes, it's free healthcare. It's free healthcare, which you've paid for with your taxes, but they have waiting lists. So you're on a waiting list and waiting much, much, much longer. And then from a professional perspective, in the UK, it is very difficult to rise through the ranks. I remember you would have to, if you wanted to go and do, let's say you wanted to go and do a master's, you could do a master's and be self-paying for that master's, but there were certain types of master's degrees that required you to apply through your employer, and they would not accept your application if you were not applying through your employer through the NHS. And so you would have to speak with your manager and say, hey, I really want to do this. And the first thing they would say is, I don't have budget approval for any more people to study this year. Maybe wait until next year or the year after, depending on how many people are waiting to do that master's program. So your ability to advance in terms of your educational prospects and things like that were very much determined by, does your manager like you? Is there money in the budget to sponsor you? And the fact that it's tied to the master's is tied to your employment and you can't do it without your employment is restrictive in itself, because a lot of people have to say yes to you to be able to do something that you should just be able to do if you want to. In the US, if you want to do a master's program, that's up to you. You can apply whether you decide to pay for it yourself, or if you work for an employer that has a benefit system that either pays your tuition for any education that you choose to do. They have arrangements with colleges and universities, and you can go into a portal where you look at the kind of courses that are on offer, that your employer has an arrangement with whatever university all over the country, especially now that you can learn remotely. You can pick a university in Arizona while you're living in Texas, and there's a benefit linked to your employer where they'll say, okay, every year you've got $5,525 that we will pay for tuition for any program you want. So, and that's a lot of employers. So far, all my employers have had that benefit. And then there's the working conditions. My experience initially, when I first arrived in the US, I really struggled. I felt like I was working much, much harder than I had ever worked before, because I was coming from the UK, where in ICU, it was one-to-one, one nurse, one patient. But we also didn't have respiratory technicians, which we have in the US. So if you're an ICU nurse, you had to have really good knowledge of the ventilator, and you had to have just really good knowledge of how to look after an ICU patient. I felt like we had a lot of autonomy in the UK as ICU nurses. On med surg, which is what is just a general ward in the UK, the patient to nurse ratios were higher, because I think I remember one nurse would have two bays where each bay might have 6 patients. So one nurse might have a total of 12 patients. And then there'd be maybe 2 or 3 healthcare assistants on the unit doing things like assisting patients with their activities of living, like personal care and feeding and all that. So, as a nurse, if you're in med surg, most of what you're doing during your shift is giving medications, because as soon as you're done with that big drug trolley with the 8 o'clock medicines, when you finish those ones, you're moving on to do the next round for the 10 o'clock ones. And we used to do the sterile compounding of medications, which, when you're here in the States, many of the medications have already been mixed for you by pharmacy. Occasionally, you will have to do some sterile compounding where you're mixing the powdered medication with the sterile saline or whatever it is you're mixing it with. So the time it took to do sterile compounding, labeling, and all that, and studying IV antibiotics, etc. It took so much time that what I found was, for many nurses on general wards or med surg, they spent a lot of their time just giving medications. And then occasionally, I think you would probably go and do things like wound care, social work referrals. You might attend a multidisciplinary team meeting, depending on what level you're at. In the US, on the other hand, in ICU, it's 2 patients to one nurse. So if you have 2 patients who are ICU status, so they're, hopefully both on a ventilator and sedated, it's 2 patients to one nurse. But they also have respiratory technicians whose job is to look after the ventilator and do ABGs, etc., etc. So your focus is on the other things that the patient needs, like maintaining the drips and whatever else needs doing for that patient. It was very hard for me to switch from going from one-to-one to one nurse to 2 patients. On top of that, the amount of documentation that you do in the States compared to the documentation that you do in the UK is just exponentially higher. There's so much documentation in the States, and there's no paper charting. So everything is electronic, and you do these 4-hourly assessments, which are very, very long and very, very comprehensive. They take a lot of your time, which, if you're not careful, that can take away from actual patient care. In the UK, I found that I gave better patient care because I wasn't so focused on all that documentation and charting. And also, I had just the one patient in the ICU. So I was more satisfied with the care I gave as a nurse in the UK than the care that I give as a nurse in the US. In terms of the ability to be autonomous and think critically and all that, I would say I learned a lot more in the UK than I did in the US, because I guess when you don't have as much technology, you really depend a lot on your knowledge and your skills. When you have a lot of technology, you can end up being too dependent on the technology. And so that can take away from your ability to grow and build skills, in my experience anyway. Or maybe because I came here when I already had quite a lot of experience. I don't know what that would feel like for a nurse with less experience, but for me, I felt like I brought a lot with me from the UK. Um, and then another thing to look at in terms of the differences between the UK and the US is obviously salaries. The salaries in the US, as I've mentioned before, are far higher than the salaries in the UK. So, as a nurse in the US, you will make a very good living. You will make a very good living, and you'll have many, many options. If you want to go and be a nurse practitioner, that's on you. You just go and apply, and you go and be a nurse practitioner. Do your master's or your doctorate and become a nurse practitioner, or a certified registered nurse anesthetist, or whatever it is you decide to do, you can go and do that. For someone like me who's got over 20 years experience in nursing, it isn't worthwhile going back to school to go and do a nurse practitioner or CRNA um, at this point, because it wouldn't pay me back what I put in terms of the time and what I put in financially. It would take away quite a lot of money from me to pay my fees, um, and then the time I would take studying as well. So it isn't worthwhile. And then when you look at the compensation you get, the pay you get with the more years experience you have. So when I arrived here, I was paid, once I was in a permanent job, not an agency nurse. My pay was matched to my years of experience. So they even counted the years that I was a healthcare assistant in the UK while I was a nursing student. Those counted towards my experience. So it really starts to pay off the more years of experience you have. And also, even without a master's, the opportunities to grow and move into other things away from the bedside exist. So I'll give you an example. I don't have a master's and I don't plan on getting one, but I work in education. And I know that I bring a lot of experience that someone else with a master's degree might not be able to bring, because yes, a master's is great, but experience is, in my opinion, more valuable, because you've actually lived it and done it. Whereas with a master's, you've done a lot of studying and tests, and which I don't minimize the amount of work that goes into it. But experience, don't, if you're someone who's not wanting to progress in terms of master's degrees or doctorate degrees, look at your experience, and it is very valuable. There will be people who will look at your experience and think, yeah, this is actually really, really valuable. And then working conditions. I think I talked about the nurse to patient ratios, but I found that the working conditions vary depending on where you are working. There are some places in the UK where the culture is really, really good, and the management, even though we have a very hierarchical system in the UK, there are managers who still manage to cultivate a good culture where staff are appreciated and given opportunities to grow and valued. Same thing here in the US. There are some very toxic places to work, where, it might not be as hierarchical, but it can also be just really, really toxic. And that's, I guess that's something you're going to find anywhere in any work environment, whether it's the UK or the US. I do find that the hierarchies that they have in the UK, a little old fashioned, in my opinion, and probably something they should really be moving away from, because I don't see the value that it adds to patient care or even just to morale. You want the people looking after patients to feel good about coming to work, not to feel as though they're going to work because they have to, but they're not really appreciated. In terms of the patients that you look after, again, that varies from place to place. I've had good experiences both in the UK and in the US. And also, as you get older, the way things affect you in terms of how patients treat you changes, because your goals and your motivation from going to work also change. When you're starting out your career, you're not even really sure what you're doing. As you are more established in it, you know exactly why you're going to work, and you know what you're going to allow to affect you and what you're not going to allow to affect you. So I'd say those are the main differences that I've seen between the UK and the US. I prefer the US, one, because having that technology, even though it can be restrictive in terms of your growth and your ability to think and use your own mind, as opposed to using a computer or whatever to think for you first before you you use it. Yes, we should use technology to make our lives easier, but I do enjoy the ease that there is with things like, for example, medicine administration. It's really, really quick. It's really easy, and even the fact that you're tracking which medications were given, what time they were given, etc., etc. Just having all that information to me is preferable. And then obviously the pay. I prefer the States because I get paid way more than I would have ever made if I was still in the UK. And then in terms of patient ratios, I do miss having one patient to one nurse like I did in the UK, the one-to-one. And then in terms of opportunities, the US wins hands down. It's really up to you how far you go. It's really up to you. Whereas I felt the UK was really very restrictive in terms of being able to progress in your career if you're a nurse. So I don't know. I'd be interested to hear what you guys think. Would you pick the UK over the US or vice versa? Would you want to have free healthcare but wait longer to get treatment? Or would you like to have healthcare now, like when you need it and when you want it, but pay possibly more for it? I guess you'd say it's more because you're paying for health insurance, even though, in my opinion, if you're paying for it through your paycheck in the UK, then it isn't really free. So it's the same, but just you get more for your money in the US, in my opinion. That's been my experience. So I'd be interested. I hope you comment below and let me know what your thoughts are. And also, please do like and subscribe and comment, because that's really very helpful in terms of getting these videos out to more people. I enjoy making them and I love seeing when people have watched them. So I'll see you in the next one.